how does tinnitus affect on mental health, stress, and even sometimes depression they go for?
Yeah, because you see, as I told you, the head is a closed chamber. So when you're sitting in a room, in a TV studio or in a computer room, because majority of the work is computer related nowadays, a sound in the ear will start. When the sound starts, he gets the limbic system, that is the system for concentration, attention, perception and your day-to-day activities gets affected. When this gets affected, the person totally goes bizarre basically. So when it happens in one ear, he is able to tolerate a little bit. When it happens in both the ears and comes to the center of the head, he is not able to concentrate upon the subject. And more importantly, tinnitus affects sleep.
Yeah.
So when it affects the sleep, naturally lack of sleep itself is a problem for his attention and depression. So this keeps going on. Suppose a person gets tinnitus at the age of 25 or 30, imagine the stress that he'll be facing for the rest of his life. So this is the most stressful condition than other condition which is related to pain and other things. They are also stressful, but tinnitus is more stressful because it is very close to the brain and also the noise itself amplifies itself because tinnitus grows in phases. So the frequency shift will take place. When it goes to the higher frequency like the whistles or the cricket in the forest, the small insect, if that sort of sound is created, imagine what happens.
Yeah.
So just to give an example, a male mosquito has a frequency response of 2500 hertz per second, whereas a female has 3500. So when a mosquito comes very close to your ear, you get disturbed totally, even if you are asleep. But somebody has tinnitus at 6000, 8000, imagine the high frequency, how he can survive with it. Even a mosquito coming near your ear for just 2 minutes itself is totally distraction. You don't sleep and then you are scared about the mosquito. Irritated and your whole balance is lost. So imagine the same sound is coming continuously or in a pulsed way for the whole day and for the whole night. What will be the status of the tinnitus? So that shows how bad is tinnitus.
So, sir, why is tinnitus dismissed as a minor thing when a patient suffers with it? He'll be feeling like it is life-endangering and all.
Yes, tinnitus is not taken up very seriously because of two reasons. One, there is no cure for tinnitus. That's one of the reasons. There is no cure in the world at present for tinnitus, which can say any doctor or any pathologist or anybody for that matter says, okay, take this or do this, your tinnitus get cured. There is no such thing in tinnitus medical history or in the medical sciences as of now, as of today basically. There is only management. So when it comes to this position, the doctor says, okay, you have been living, you start to live basically, or you ignore the problem. These are the only two things, or the doctors may give a course of medications for him. But if the chronic tinnitus is persisting for months and years, the patient himself knows that there is no treatment for me, I have to live with it. And he goes to the doctor, but when the same explanation is given, he comes back disappointed basically. So of late, several technologies have been developed, which we will be discussing. So that is why the doctors also dismiss it, because before dismissing it, the doctors do a thorough study for the person with an MRI, CT scan, or hearing audiological tests like pure tone audiometry, impedance audiometry, brainstem audiometry, and all these things. And when they find that everything is normal, they treat it as a symptom and they try to counsel the patient and dismiss it, even though the patient feels it is life-threatening.